This is a chiropractic teaching video. Our patients are Jean and Keisha, Prudence, Marcus, and Christopher. This is their story. Jean and Keisha, a mother-daughter team. I'm inquiring with Jean how she's doing. This is their second visit.
I think it was good.
Okay, let's start. We're going to stand you over here.
But here hurt.
Is it sore or did it?
Sore.
Okay, we'll do this again. All right, all through this video, the sound quality is not great. We have a waiting room full of people. We have thin, old wood paneling walls. The muffled sounds remind me of something out of Dante's Inferno, but you're always going to hear this background noise. That's the way this video is going to be.
Behind the neck.
Yeah.
Keisha, hold the glasses.
Just like that. Oh, let me see. There we go. Okay. All right, you look up for me. On your back, face up.
Sorry.
No worries. Keisha, how are you after your last adjustment?
Well, see, I stepped out, just a little thing in the back.
Better overall? Keisha, if you feel uncomfortable, we can shut off the cameras. We don't have to.
No, I'm fine.
Okay. I want to make sure you ladies feel safe and comfortable. Oh, you put your hand like that. Just this hand. Yep. You relax. You like that, didn't you?
Let me ask you a question. Where you do business? Which part of your place there? Where matters?
California. I want to hear till August 29th.
Yeah, but I can't remember California with you.
Say again? Jean and I sometimes have difficulty understanding one another. However, I think I get the gist of the conversation without understanding all the specifics.
Can me up with you and practice for me?
You're going to open a practice in Jamaica?
Yes?
I'll come maybe once. I'll see, I'll come a couple times a year.
But you do it good. I like how you do it.
I know.
Yes? Come do this.
Put it behind your neck. Yep, just like that. Jean, come towards me with your body a little bit. You relax.
There's something I was supposed to say.
Okay, so today we did our ribs, we did our low neck, we did our upper thoracics. You're going to be sore, but you're going to feel much better, okay? How's that?
Good.
Feel different? Probably your same as your mom, so let's get you stand right here. Here. And squeeze your elbows together. No. One of the things that's very apparent to me throughout the whole time with Keisha and Jean is I kept looking at Keisha thinking she's a young person who's disinterested in life, and that's common for a lot of young people. However, later on, it becomes very apparent what she's actually suffering from is social anxiety, and that her nervous system is so spun up that she's having a difficult time interacting with other people. I know, I need a break too after treating patients.
Yeah?
On your back. Let's do this. Are you okay? Every time Keisha gets adjusted, her nervous system is changing. So she's going from a distressed state to a de-stressed state. And as those changes are taking place, she's having a difficult time becoming accustomed to that because that's not her normal. Her normal is high stress, social anxiety, this feeling of just internal terror. You'll watch as we go through this case, every time she gets adjusted, she's having to recalibrate what's taking place within her. Don't let me pull. Don't let me pull. Okay, you rest.
This good, let me get good.
Say again. Well, I'm glad you feel better. Keisha, do this, turn your head this way. Don't let me pull. Ready? Keisha, push towards that pull. There you go. That's okay. I'm gonna try a different spot. Here I'm challenging different levels of Keisha's neck to see which level will normalize the tonic neck reflex. Don't let me pull. There it is. Okay. Okay, let's get you to walk. You just sit for a second so you don't get lightheaded. Let's adjust this rib on your back. Come down a little bit. It's currently 3:30 in the morning while I'm editing this video, and those of you who edit YouTube videos know what I'm speaking of. However, I will see these patients later on today, so I should probably wait to see what their results were from this visit. But her system is going through a change, and one of the things that's very common is patients will tear up. After they have adjustments that calm their system down, that de-stress them, the nervous system is overwhelmed, and we see this commonly with chiropractic or massage. She's going to go through these changes. They're going to be tough on her system to incorporate initially, but once her body processes this, she's going to be doing much better. All right, walk around for a second, see how that feels. I know it's a little sore because it's been out of place for such a long time. Let's see. How's that?
Feels very good. Just a little bit dizzy, but feeling good.
Sit for a second. So once again, we're seeing this processing taking place, right? This reincorporation of normal sensory inputs, the nervous system being overwhelmed, the person going through their own personal changes with chiropractic care and what it does to their physiology.
And the ribs.
Yeah, we did. We did her right rib cage. That was that.
Because that one was out.
That's the one we did with that arm behind her neck. So we'll see how you do next time you come back and let the soreness dissipate, and then we'll see. Keisha, are you in pain right now or uncomfortable or how are you feeling?
Can't explain. No pain, but just feel.
Here we see it. She doesn't know how to properly explain what's taking place. This is an abnormal sensation for her. Do you feel dizzy? Do you feel light? Do you feel...
Just feel light, not dizzy.
So you feel light.
Yeah,
Do you feel calmer?
Yeah.
So you're less stressed than when you first came in?
Yeah.
Okay. That's a great sign, so that's good. Yeah, I'm leaving on the 30th, so you have to come...
Yes, because I want you to work on me.
Yeah, I know.
Yes, I want you to work on me. You work good.
Thank you, thank you.
This,
Is your doctor in here?
Just right here, not.
Let's do this on your stomach. But are you having a hard time communicating how you feel, or what's...
Sometimes. Sometimes it's too much. It's just.
You mean with everybody, not just me? I see. Here it's becoming very apparent to me. She has the social anxiety. She has an internal nervous system that's really spun up. She's making too much cortisol. She can't process information. There's sensory overload. Her system can't calm down. And so now it's becoming very clear why she seems disassociated in the conversation in the beginning of our session. Okay, let's do something. I see. So do you sleep well at night?
No, I sleep.
Okay, so we are clear. You've been a poor sleeper. You saw me. I adjusted you. You slept well.
Yes, she said.
Okay,
Yeah.
okay. So every time you see me, remind me we're going to do a little extra things on you. I have to be cautious. Now I understand why you're feeling awkward. You're feeling awkward because you have an internal nervousness in you, like butterflies in your stomach all the time. And then when we adjust you, they go away, and then you're not accustomed to feeling normal. This is normal. Okay? You being anxious is not normal. I think that's the communication issue that we're having. So luckily, but I've been around a lot, so I understand what's going on, okay? On your start. I'm gonna give you one more adjustment. You're gonna be who's driving? You guys took a cab, right?
Yes.
Okay, so she's gonna be tired after this adjustment. She's gonna need to go sleep.
She can't sleep in the car.
Okay, wonderful. I know what you have. You're gonna hate me for a second. I'm gonna ask for forgiveness in advance.
Why? Christine, I love me. You're not just from the back. You're not just from the back. You're not just from the back.
You rest for a minute, okay?
You don't understand why you're not just from the back.
You're allowed to cry if you need to. It happens when patients have been
Huh? You don't understand that.
Do you want me to adjust your back?
Yes, my back is stupid.
It's totally okay. Here I want to simply remind Keisha that this is a normal process, that she doesn't need to have any guilt or remorse or shame, and that it's a process that she needs to go through in order to feel better, and luckily chiropractic can assist her in that.
Prudence.
Better, you're going to be calmer, your road is going to be much
We don't remember that. We get it back. I'm excited.
Yeah, by your wall. Next to Jesus. So listen, you're going to feel calm the rest for a very long time. You're going to feel more normal. You're not going to have your social anxiety. People are not going to stress you out. You won't have a social discomfort. You're going to communicate with people easier. You're going to feel more comfortable. Everything's going to be better. Okay?
I can't you get it.
Well, you got to look. I'm leaving soon. Okay? So we have to come see me. Come see me before I go. Okay?
Yes, come and see you. Okay.
Thank you, Keisha. You're going to be much better.
Thank you, Doctor.
Thanks, Mama.
Yes.
Thank you. Did see these patients later on in the day. This is their next session. This is a great case study in what chiropractic can do for patients who are suffering from anxiety, that it's caused by a lack of appropriate inputs and a lack of proper proprioception. So not every person suffering from anxiety or panic attacks will benefit from chiropractic, but this is a good example of a patient that did. How's your sleep been?
The first time I sleep at the
Yeah. But you are calmer as a person.
Yeah.
Yeah, you're engaged, you're
And
talking.
more expressive.
I'm sorry?
Can more express myself.
Yeah, absolutely.
Mhm.
Wonderful, wonderful. I'm very happy about that.
Yeah.
Here we see that Keisha's engaged. She's not disassociating. She's not apprehensive. She's more expressive. So this is a great thing where chiropractic care can help patients express themselves more fully, and so that patients can live to their optimal performance. So Keisha, how are you feeling overall?
Good.
I know you're sore. How you...
But breathing, I used to have like asthma. It's asthma. Couldn't breathe like, but that's not really affecting like so much.
Okay.
Very different.
Wonderful. Keisha, how are you doing, by the way?
I am great. I am super great. I sleep better. I am not so anxious. I am fine. I am great. Words can't explain how I feel, because you see me when I came in the first time and my situation was really bad. But I'm good.
Wonderful.
Thank you.
Wonderful.
To come back and do some more work.
Well, I should come back once a year. That should be mine.
But once a year too far.
I know.
Once a year too far. You need to come back
Okay.
like 3 times per year.
3 times?
Yes, we need you.
I mean, yeah, I know.
We need you.
I'm lucky. Look, I'm very happy that I got here, period. And I'm happy that, that I could improve some people's lives.
Yeah. That's true. So we need you here at least 3 times per year. Not once per year, 3 times per year. We need this, doctor.
This is my patient, Prudence. Prudence is suffering from back pain. I don't really realize until later on she's also suffering from extreme headaches, something she's been suffering from quite some time. She's been seeing the previous chiropractor, and while it is beneficial, it's not the sustained relief she needs. She does suffer from high blood pressure, which can be an underlying cause of headaches. During this session, I'm going to actually see if we can find a segment that's out. I'm going to adjust her occiput, and her next session, which is not included in this video, is we actually looked at C7 and some of the referral patterns that trigger points can do from the lower cervical spine up into the head. So most of us have some type of damage, so that's a part of being human. But that doesn't mean you need to be in pain. So I'm going to see what I can do to take out the pain. This is the first time we've seen each other, correct?
Yes.
Does it hurt when you bend or walk or sleep or do what?
When I bend, if I bend too low, or when I bend to get up, this I'm having the pain down in here.
Actually put you on your stomach.
You want me to lie in my stomach?
I do.
Okay.
So your pain is here, correct?
Yes. Down below.
Prudence, try this. I want you to pull this foot towards your back. I'm going to try to straighten your leg. You're going to stop me from doing that. Pull this foot towards your back. Go. Good. You did great. Try the other side. Don't let me pull. Good. I'm going to scratch your back. I'm going to try the same test. Don't let me pull. It's actually normal, so don't feel bad.
Okay.
Try again. Okay, that one is not normal. Try again for me. Go. Okay. So basically what Prudence has here is a lack of inhibition with the Galant reflex. So it's telling me she has some type of dysfunction in her sacral or L5 area. Because she has the chronic low back pain, I'm going to do some trigger point work on her iliolumbar ligaments and try to just simply break up some adhesions in there, get them to loosen up, and see if this takes some of the tension off of her low back. Bend his top leg. I'm going to borrow his arm. What's very common, once again, is when doctors replace doctors. So what the patient's doing is she's going into the position for a long lever adjustment. I don't do long lever adjustments. So this is very common that patients are, having to change what they do based on the doctor. Like that, you're going to rest your head.
Okay. Jeez. Oh gosh.
You rest.
Okay. I'm good.
I know. On your back.
Oh.
This is how pain should be treated, huh?
I'll never get that treatment. This is better. Oh.
One more. How's that?
So good. So good.
Now it's great. You should walk around the table once or twice and see how you feel.
Only a little, when I was getting up,
Yeah.
just a little pinch, like just a,
But it's different.
it's different. It's different. I'm hoping this will take away all the headaches that I'm having.
You're having headaches? On your back, face up.
I'm having so much headache, I can't even focus.
Okay, we're gonna fix that right now. I'm gonna push this leg like this. You're gonna stop me from doing that. Ready?
I'll stop you from.
Listen, you push it that way.
Okay.
Right. Basically here I want to make the assessment of where she's having dysfunction. Is it her occiput, her C1, her C7? She's obviously been seeing the chiropractor prior to me, so we need to look for a more specific area of dysfunction. Don't let me push.
We're gonna get rid of your headaches right now.
So I've made the assessment that her level of dysfunction is at her occiput on her C1. So we're going to be adjusting her skull on her neck. Prudence had never had that style of adjustment before. We're going to see what impact it has upon her headache.
You rest for a second. Don't worry, you rest. You just rest for a little bit. You need it. You don't need to get up right this second.
Once again, here we see a patient whose system has been under a tremendous amount of stress. We simply de-stressed her.
Feels so light.
I know. You just rest for a little bit. You've been stressed way too long, way too hard. You're gonna feel better. Everything's gonna be better.
I want her body to reincorporate all that normalcy, because this is something that's going to be very unfamiliar to her system.
That would be good because I have not been feeling any better coming, seriously.
I know, but I have a different level of skill. God sent me to Jamaica to take care of you, okay?
Oh, I'm so elated right now.
Well, you can tell your friends they need my care too. How do you feel?
I feel so much better. Especially the headache.
I know.
Even last night, I just have to sleep because the headaches has been so bad.
I know. Come see me as many times as you can before I leave.
Okay.
I'm a great doctor for you. I'm really good at what I do. So
I will.
maximize your time here, okay?
I will, most definitely. Thank you so much.
Prudence, thank you. And
I'll see you on next session, which is Tuesday?
which is Tuesday. I'll see you on Tuesday.
Yes.
Thank you.
All right. I bring you some Jamaican
You are the best.
This is Prudence's third visit, and she's noticing that her headaches are associated with stress when she's studying.
Thank you very, very much. I'm going to enjoy these immensely. So thank you.
Welcome.
Prudence, tell me about your headaches.
Well, as I tell you, you have worked magic because the doctor gave me a prescription for tramadol and whatever. I do not fill the prescription because whatever you did, it helped. So I came back once because I'm doing this course, maybe that was it. And then last night, I was doing the course again.
So when you
night.
get stressed, your headaches come.
Right, so it continues.
So you have a headache right now?
Right.
Okay, we're gonna do something different. So
Now I've shortened this video clip for the essence of time, but basically we did some internal cranial faults, did some TMJ trigger point work, and wanted to see what impact that had upon her muscle strength and upon her subjective feeling of her headache.
how's your headache?
None.
Okay.
None.
So they probably are stress-associated headaches. Stressed causes an elevation in their blood pressure, can cause headaches. But I think you can do much better after today. So let's see. This is our third visit, fourth visit.
Third.
Okay. I got a suspicion you're gonna be normal. That's what we want.
Yes.
All right, you walk around, see how you feel. You walk, see how you feel first. Yeah. How do you feel?
I feel good. I just wanna sit and see how I
Process.
Yeah.
Marcus, try this again. Push up. Up, 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 up.
It's my patient Marcus. Marcus has some type of ailment. It's not my area of expertise, I don't know what it is, but he has some type of either muscle wasting or some type of infection or something that's causing him to lose his muscle mass and have coordination issues.
Dr. Stevens, thank you.
So I told him that I could help him with chiropractic. He does feel better when he gets treated. He does have better movement, better control, better balance, but he has a secondary condition that I'm unfamiliar with.
Let's go get you to walk.
Medication.
Let's get you to walk for a minute and around the table. See how you feel.
So as practitioners, one of the important things to remember is the amount of force and thrust that I'm going to do with Marcus is very different than the thrust I'm going to do with Jean or Prudence.
But since I come here the last time, I feel much better. When I feel the stiffness in my back again, and I feel the stiffness, I walk much better.
How's that feel right now?
This feel more freer.
Yeah. Drop your arms. Drop it. And look up. Look up. You're taller than me.
Yeah.
All right, go walk. Try that. How's that feel?
Yeah. I feel much better.
Yeah, we need to go. We should get you checked out for some other things. I mean, you should see another practitioner for some, because the way you're walking, you know, it's not my area of expertise. I'm going to help you with chiropractic. I'm going to make you feel a lot better, but we need
Blood.
you need to have some other professional figure out what else you have. So, okay. Thank you. I'll see you on Saturday.
This is my patient Chris, who I saw previously. I recognized during his first visit that he had a scar on his skull, which told me that's where he had a trauma, which is causing him to have movement issues. This is our second visit. It may look a lot like our first because we're both wearing the same outfits. What I'm having Chris do here is raise his legs. And this is one of the ways those of you who don't do muscle testing can check muscle function. So I'm having us lift his legs. Then we're going to do some type of therapy or treatment. I'm going to have him go back and relift his legs and see if it's easier or more difficult. Anything that causes his legs to be easier to lift, I'm going to do. Things that cause him to have more difficulty, we're not going to do.
Your legs, see what happens. Easier or harder?
Harder.
Okay. Harder.
I did a little mobilization on his left TMJ.
Let's try that.
It improved his ability to raise his left leg. His right leg had no impact. I'm going to make the adjustment then on his left TMJ. I'm putting a block under his cranium to give some elevation. This portable table doesn't have a real great headpiece.
Yeah, keep your head right there. Chris, open your mouth. Close. Open. Close. Open.
Oh!
You rest for a little bit. Let's go get you to walk and just see what your legs feel like. Are you dizzy?
I just feel loosened.
Hey Chris, let's see how your legs feel.
Not very bad.
How's that?
Better. I mean, I'm still wobbly, but not like when I came in.
Yeah.
Not as wobbly. I'll do it.
I know, but your system can only handle so much.
I will take whatever. Trust me. I will. I mean, crack my neck, move anything I want to right now. Believe me.
One of the things that we as practitioners have to be cautious of are patients who are both excited by our care but also want more. In essence, they want too much care in one visit, and that's traumatizing to their nervous system. Chris is impatient. He wants me to treat him and crack him and do all of the things that we can do. The thing is, if I did that, that would actually be detrimental to his nervous system. I would exceed his metabolic capacity. I could actually kill neurons. So I need to be very cautious with him and his expectations and his impatience to get better.
I'll see you this Saturday.
Okay.